Eating disorder types. Bulimia nervosa. Bulimia nervosa is another well-known eating disorder. Like anorexia, bulimia tends to develop during adolescence and early adulthood and appears to be less common among men than women. People with bulimia frequently eat unusually large amounts of food in a specific period of time. Each binge eating episode usually continues until the person becomes painfully full. During a binge, the person usually feels that they cannot stop eating or control how much they are eating. Binges can happen with any type of food but most commonly occur with foods the individual would usually avoid. Individuals with bulimia then attempt to purge to compensate for the calories consumed and to relieve gut discomfort. Common symptoms of bulimia nervosa include recurrent episodes of binge eating with a feeling of lack of control, recurrent episodes of inappropriate purging behaviors to prevent weight gain, self-esteem overly influenced by body shape and weight. Binge eating disorder. It typically begins during adolescence and early adulthood, although it can develop later on. Individuals with this disorder have symptoms similar to those of bulimia or the binge eating subtype of anorexia. Common symptoms of binge eating disorder include eating large amounts of food rapidly, in secret, and until uncomfortably full, despite not feeling hungry, feeling a lack of control during episodes of binge eating, feelings of distress, such as shame, disgust, or guilt, when thinking about the binge eating behavior. No use of purging behaviors, such as calorie restriction, vomiting, excessive exercise, or laxative or diuretic use, to compensate for the binge eating. Avoidant/restrictive food intake disorder. Avoidant/restrictive food intake disorder, ARFID, is a new name for an old disorder. The term has replaced the term feeding disorder of infancy and early childhood, a diagnosis previously reserved for children underage. Individuals with this disorder experience disturbed eating due to either a lack of interest in eating or a distaste for certain smells, tastes, colors, textures, or temperatures. Common symptoms of ARFID include avoidance or restriction of food intake that prevents the person from eating enough calories or nutrients, eating habits that interfere with typical social functions, such as eating with others, weight loss or poor development for age and height, nutrient deficiencies or dependence on supplements or tube feeding. Other eating disorders. Purging disorder. Individuals with purging disorder often use purging behaviors, such as vomiting, laxatives, diuretics, or excessive exercising, to control their weight or shape. However, they do not binge. Night eating syndrome. Individuals with this syndrome frequently eat excessively at night, often after awakening from sleep. Eating disorder treatment. Treatment options include individual, group, or family psychotherapy. A type of psychotherapy called cognitive behavioral therapy, CBT, may be recommended to help reduce or eliminate disordered behavior such as binge eating, purging, and restricting. CBT involves learning how to recognize and change distorted or unhelpful thought patterns. Medications. A doctor may recommend treatment with medications such as antidepressants, antipsychotics, or mood stabilizers to help treat an eating disorder or other conditions that may occur at the same time, such as depression or anxiety. Nutritional counseling. This involves working with a dietitian to learn proper nutrition and eating habits and may also involve restoring or managing a person's weight if they have experienced significant weight changes. Studies suggest that combining nutritional therapy with cognitive therapy may significantly improve treatment outcomes.